drug that's in that class, you can be tested on that we've gone over, okay? Alright, the first class of drugs we have are the anticonvulsives or anti-seizure medications. One of the prototypes are fentanyl and phenobarbital. Adverse effects, we have sedation, drowsiness, gingival hyperplasia, vertigo, dizziness, thrombocytopenia, aplastic anemia. The things you want to teach your patients when you're giving them these anti-seizure drugs. Females, you want to advise them to use contraceptives because this is, these medications are not okay to take during pregnancy, okay? Inform clients that fentanyl is that the urine discoloration is harmless and is common. Warn clients with diabetes that fentanyl may increase their blood sugars. Patients may be worried that they're gonna get addicted to the barbiturates, but you gotta reassure them that we're giving it in low doses so they're not gonna get addicted to it. Make sure you teach your patients not to drink alcohol while taking these medications. If you're giving a fentanyl IV, you wanna push it very slowly because it's gonna burn and to help avoid cardiotoxicity. Fentanyl is also a drug that you don't want to mix with anything else if you are giving it IV. Anti-Parkinson agents. We have the anticholinergic agents like Congentin and Artan. And the dopaminergic agents like levodopa and the carbidopa-levodopa, which is Cinnamate. Levodopa can cause nausea and vomiting, anorexia, orthostatic hypotension, so it's really important that you want to teach your patients to get up slowly. And can cause dark colored urine and sweat to be colored as well. Things you want to teach your patients for the anti-Parkinson drugs. Give dopaminergic agents after meals to reduce the GI symptoms. Reassure clients that levodopa may cause the harmless darkening of the urine and the sweat. Avoid taking vitamin B6 because it reverses the effects of levodopa. Again, be sure to tell your patients to get up slowly to avoid the orthostatic hypotension and teach them to elevate their legs to reduce the edema in their ankles. Drugs affecting mental function. These are your sedatives, your hypnotics. These help patients go to sleep and stay calm. The big prototype for this are the benzodiazepines. An easy thing to remember with these is they all end in EPAM. So you have your diazepam, your lorazepam, your olorazepam. Barbiturates are also used to help sleep and calm patients down. Phenobarbital is the prototype for that still. Adverse effects for these drugs include patients may come in and say they feel like they have a hangover after giving them the medication, dizziness, CNS depression, respiratory depression, and drug dependence. It's also important to teach your patients with the CNS depression, again, teach them not to drink any alcohol while taking these medications. Warn clients of injuries and falls. They may have brief periods of confusion and excitement upon waking, which is common. Warn clients not to discontinue these drugs suddenly or abruptly. If they decide themselves that they feel like they need to be off of the drug, they need to notify their physician so they can start tapering off the medication. If you're given, barbiturate IV, do not shake the ampule. You wanna rotate it or rub it between your palms of your hands. Remember, don't mix it with anything else IV. You also wanna notify female clients that diazepam or Valium is associated with cleft lip, so they shouldn't take it while pregnant or trying to get pregnant. Drugs affecting mental functioning, antidepressants, and mood disorder drugs. You have your tricyclic antidepressants like amitriptyline, the MAOI, Nargil, your second generation antidepressants, Prozac. Adverse effects of most of these drugs include dry mouth, blurry vision, urine retention, constipation, orthostatic hypotension, insomnia, and the MAOIs can cause a hypertensive crisis. Due to the orthostatic hypotension, you want to teach your patients to get up slowly. You want to teach your patients to take their antidepressants with food to enhance better absorption of the medication. Be sure to explain to your patients that the medications aren't going to start working immediately. It may take 2 to 4 weeks for them to start seeing any changes. Assess client for constipation resulting from tricyclic use. Teach them that they can take any over-the-counter stool softeners to help with the constipation. Clients taking the MAOI inhibitors should avoid foods containing trimin, things like aged cheese, sour cream, yogurt, wine, chocolate, soy sauce, anything with yeast in it, so any kind of breads. If your patient taking fluoxetine develops a rash, you want to teach your patient to withhold the medication and they need to call their doctor. Antipsychotic drugs, Thorazine, Haldol, Zyprexa. The mechanism of action is to block the dopamine receptors in the limbic system, hypothalamus, and other regions of the brain. Adverse effects, you can have extrapyramidal syndrome or EPS. This includes dystonia, pseudoparkinsonism, and irreversible tardive dyskinesia. They can also get fever, tachycardia, tachypnea, diaphoresis, cardiovascular collapse, muscle rigidity, seizures, and orthostatic hypotension. Teach family members signs of EPS and NMS. Teach family members to report these to the physician immediately if they see them. Normalization of symptoms may not occur for several weeks after taking the medication, so be sure to notify your patients that they're not going to see these medications working immediately or overnight. Teach your patients to get up slowly for the orthostatic hypotension. Watch for photosensitivity. Be sure that oral doses are swallowed whole and not hoarded or not broken in half. Drugs used in pain management. There are analgesics, which are, you have your narcotics like codeine, loperamide, morphine. Then the non-narcotic, you have NSAIDs like aspirin, Motrin, and Tylenol. The mechanism of action for the narcotics are to alter pain perception by binding to opioid receptors in the CNS. The mechanism of action for the non-narcotic is to relieve pain and fever by inhibiting the prostaglandin pathway. When you're given any narcotic, you want to always check your patient's respirations, because this can cause respiratory depression. Teach clients that injury and accident precautions while taking the narcotics. It'll make them very drowsy. Warn clients about the possibility of dependency once they start taking the narcotics. Do not discontinue narcotics abruptly in those that are dependent. Narcan is your antidote for any narcotic. Advise clients to take NSAIDs with food to avoid GI upset. Monitor clients taking NSAIDs for any bleeding. Aspirin is contraindicated in anyone below 18 years old. Monitor your clients for hearing loss if they are taking the aspirin. These are your anticoagulants. You have your heparin and your warfarin. Heparin prevents thrombin from converting fibrogenin to fibrin, and warfarin suppresses coagulation by acting as an antagonist of vitamin K after it's been in the blood system for about 4 to 5 days. The reason that somebody will be taking any of these anticoagulants is to prevent any thrombosis, pulmonary embolism, myocardial infarction, which is a heart attack. The major adverse effect of any anticoagulant is bleeding. They're gonna bleed a lot more. Remember, the PTT is the test used for heparin, and the antidote is protein sulfate. And the INR is the test you're gonna use for the warfarin. And the antidote for warfarin is vitamin K. You wanna teach your patients if they are taking warfarin to reduce their intake of vitamin K. Which is mainly leafy green vegetables like turnips, collards. Antiplatelet drugs. They're your aspirin, Plavix. These inhibit the aggregation of platelet thereby prolonging bleeding times. They're used in prophylaxis of long-term complication following an MI, coronary artery revascularization, thrombotic, stroke. You'll also see a lot of patients will be prescribed these after orthopedic surgery, so after like a hip replacement or a knee replacement, they'll put them on an antiplatelet medication. You wanna monitor your patients for bleeding time and teach them to take medications with food. Medications affecting the cardiovascular system. Digoxin is a cardiac glycoside. It's used for CHF, atrial tachycardia, and fibrillation. It increases intracellular calcium, which causes the heart muscle fibers to contract more efficiently, producing positive inotropic and negative conotropic action. Monitor patients for digoxin toxicity, which includes nausea, vomiting, anorexia, halo vision, confusion, bradycardia, and heart blocks. Do not administer digoxin if a patient's apical pulse is less than 60 beats per minute. So it's important to always check this before giving. Patients should be cautioned with hypothyroidism and hypokalemia. The antidote is digoxin immune fab if the patient does have toxicity from it. And nitrites include nitroglycerin, azoxystrobide. The mechanism of action is to reduce vasodilation, including the coronary arteries. It's used in angina pectoris, heart attack, peripheral arterial occlusive disease. The main adverse effects from nitroglycerin are headache and orthostatic hypotension. So you're gonna wanna teach your patients to get up slowly. Nitroglycerin comes in many different forms. There's a patch, the transdermal patch, you wanna apply to a hairless area, and you want to teach the patient to change it each day. They wanna try to have about 10 to 12 hours with no patch on during the day. Sublingual nitroglycerin. You wanna be sure to check your patient's blood pressure before giving it. Offer sips of water because it also may cause dryness in the mouth. They can take one sublingual tablet for pain and repeat every 5 minutes for a total of 3 doses. After those 3 doses, or if the pain is not relieved in 10 minutes, they need to seek medical attention. Teach the patients that stinging or burning sensation indicates that the tablets are fresh. It's important to protect the tablets from sunlight, so teach your patients to keep their tablets in the vial that they come in. The sustained release tablets should be swallowed whole, not crushed or broken. Antihypertensive medications, we have our ACE inhibitors. The easiest way to remember these are they end in pril. Enalapril, lisinopril. The mechanism of action is to prevent peripheral vasoconstriction by blocking conversion of angiotensin 1 to angiotensin 2, decreasing peripheral resistance. ACE inhibitors can cause hyperkalemia, as well as a dry chronic cough. If these patients start to develop their cough, they need to notify their prescriber and not discontinue the medications abruptly. We also want to teach our patients to avoid using potassium-sparing diuretics if they're on an ACE inhibitor. Beta blockers end in OLOL. You have your metoprolol, atenolol, propranolol. They compete with epinephrine and B receptors in heart, pulmonary airways, and peripheral circulation, and CNS. They're used for hypertension, arrhythmias, mitral valve prolapse, glaucoma, Raynaud's disease, beta blockers can cause orthostatic hypotension, so teach your patients to get up slowly. Can also cause bradycardia, congestive heart failure, depression, insomnia, vertigo, bronchospasms, nasal stuffiness, cold extremities, and dyspnea. You want to teach your patients to administer the beta blockers before meals and in the morning. If insomnia occurs, check your client's apical pulse before administering drugs as well as their blood pressure. If their heart rate is below 60, you want to notify the physician of the medication. You want to warn your clients not to drive or operate heavy machinery until he or she has adjusted to being on these beta blockers. Calcium channel blockers, maybe amlodipine, verapamil, decrease cardiac contractility in the workload of the heart, thus decreasing the need for oxygen. They also promote vasodilation of the coronary and peripheral vessels. They're used for hypertension, angina, and arrhythmias. They cause bradycardia, hypotension, headache, reflex tachycardia, and constipation. Again, you want to check your patient's pulse and blood pressure before giving. Teach them to get up slowly. Administer between meals to enhance absorption. Diuretics are usually given in the morning. You want to teach your patient that that's important because if they're given later in the afternoon or at night, they're going to be up all night going to the bathroom. For your thiazides, you have hydrochlorothiazide, which is also HCTZ. It blocks sodium and potassium reabsorption. reabsorbs calcium and can cause hypercalcemia. Your loop diuretics like Lasix blocks sodium, potassium, and calcium reabsorption and can cause hypocalcemia. Your potassium sparing diuretics, spirulactone, hold on to potassium so they can cause hyperkalemia, but excrete sodium and water. Bronchodilators, albuterol is one of the main ones. They bronchodilate the airways. They're mostly used for patients with COPD, asthma, bronchitis, and if somebody's having a bronchospasm. Once you give somebody a breathing treatment with albuterol, they're gonna complain that their heart's racing. They may tell you that they're really shaky, they feel really nervous, really anxious. You're gonna try to reassure them that this is all normal, that this is side effects from the medication, that it will go away. They also feel real lightheaded or dizzy. So it's important to teach them to, again, get up slowly. These medications are contraindicated in anybody that has hyperthyroidism, anybody with a cardiac dysrhythmia, or uncontrolled seizure disorder. These medications can be used in people with hypertension and narrow angle glaucoma, but it should be cautioned. The physician should follow them closely. The glucocorticoids, prednisone, acts as an anti-inflammatory agent and reduce edema of the airways as well as pulmonary edema. The adverse effect to taking prednisone is Cushing's syndrome, neutropenia, and osteoporosis. You want to teach them to take their medications with food. Eat foods low in sodium and high in potassium. Teach clients to avoid individuals with upper respiratory infection. Teach clients not to stop medications suddenly. It should be tapered off. Avoid taking NSAIDs while taking steroids. You also want to teach your patients to take the bronchodilators first before taking the steroids. And they may rinse their mouth in between each inhalation. Antihistamines, H1 blockers, Claritin, Benadryl. The mechanism of action is to decrease nasopharyngeal secretion and decrease nasal itching by blocking histamine and H1 receptors. The indications are the common cold, nausea, vomiting, urticaria, allergies. Some people may use these as a sleep aid, and rhinitis. It's important to remember with Benadryl that it can have the opposite effect on kids. Instead of calming them down and helping them sleep, it can wind them up. Teach your patients to take these medications with food and drink. Due to the drowsiness, you want to teach your patients to use caution while handling any heavy machinery or driving. If these medications do make the patient drowsy, you can teach them to take it at night before they go to bed. They can use ice chips or candy for a dry mouth. Decongestants, Sudafed. Do not use Sudafed in clients with Drugs affecting the gastrointestinal system. Anti-ulcers, we have our antacid. We have Maalox, Tums, Alka-Seltzer, milk of magnesia. This neutralizes the stomach acidity, can cause metabolic alkalosis, stone formation, electrolyte imbalance, diarrhea, and constipation. You wanna teach your patients to give these medications 1 hour after meals. And teach your patients to avoid medications with 1 to 2 hours after taking any antacid. You wanna encourage your patient to drink as many fluids as possible to flush the antacids. And teach your patients to monitor for changes in their bowels. Histamine 2 blockers, Zantac, Pepcid, Tagamet. This blocks the H2 receptors in the stomach, which is reducing the acid secretions. You wanna give before meals or with meals. Avoid using other drugs while taking Tagamet. And teach your patients that gynecomastia may develop with chronic use of Tagamet. Alright, your proton pump inhibitors or PPIs. An easy way to recognize all of these is they end in AZOLE. So your omeprazole, anaprozole, these inhibit the proton to combine with chlorine to form hydrochloric acid. You wanna give these preferably before meals in the morning. But these medications can also be given twice a day, again in the morning before meals and then at bedtime as well, to help with the acidity. Medications for mucosal barrier, for stomach ulcers or duodenal ulcers, you're gonna have Carafate and Cytotec. These medications coat the mucosa to prevent ulceration. These medications are given before meals. The Carafate will come in 2 forms. There's a tablet and there's a liquid. It's important to teach your patient if they're taking the liquid Carafate that they take it and then wait about 30 to 45 minutes to eat after they take it. Cytotec is contraindicated for pregnant women. And Carafate can cause constipation. Your antiemetic drugs. Carval is an anticholinergic and it's used for motion sickness. Benadryl can also be used as an antiemetic. Reglan is another medication. It is a dopamine antagonist. Remember, Reglan can cause the EPS side effects. So you wanna watch your patients and teach them or their caregivers what to watch for if given Reglan. Your antidiarrheals, Lomotil, kaopectate, these decrease stomach motility and peristalsis. You wanna monitor your patient for rebound constipation. Warn your patients if they're taking the Lomotil or the kaopectate because they have some sort of viral disease and they're having diarrhea. They really wanna let the virus run its course and get out of their body, so then you wanna teach them not to take the antidiarrheal medications. gray, white, or pale stools are common with kaopectate, so warn your patients. Laxatives, your osmotic or lactulose, sweet enema, milk of magnesia, these retain fluid and distend the intestine. Fecal softeners include docusate, this emulsifies fecal fat in water. Stimulant, Viscodal or Cinelax, these irritate intestinal mucosa and stimulates intestinal smooth muscles. Bulk forming laxatives like Metamucil increases fecal bulk and water content. Lubricants include mineral oil, these lubricate and prevent colon absorption. Drugs affecting the endocrine system, your thyroid agents, Synthroid functions as natural or synthetic hormone. You want to teach your patients to take it in the morning. You want to monitor for signs of hyperthyroidism when taking Synthroid. Teach your patients these signs and symptoms, and if they start seeming, they need to see the physician for lower dosage. Your oral anti-diabetics. The sulfonylureas stimulate insulin secretions, increase sensitivity to insulin. You have your metformin and your glucovage. It can cause lactic acidosis. Avandia increases tissue sensitivity of insulin. Oral anti-diabetics are only effective for type 2 diabetes. They are contraindicated in women who are pregnant and breastfeeding. You want to teach to give it before meals, and for your patients to monitor themselves or their caregivers for hypoglycemia. The chart that's on page 9 and 10, that goes over each type of your insulin. So you have your Humalog, which peaks in about 30 to 90 minutes and lasts about 3 to 5 hours. It's rapid acting. Novolog is also rapid acting, peaks in about 40 to 50 minutes and lasts 3 to 5 hours. Your rapid acting insulin is only given to cover the meals that are about to be eaten. The rapid acting insulin is usually used along with the longer acting. Short acting, you have regular Humulin or Novolin, which peaks in 2 to 5 hours and lasts 5 to 8 hours. Your shorter acting insulin is used to cover meals eaten within 30 to 60 minutes. Intermediate acting, you have your NPH, which peaks in 4 to 12 hours and lasts 18 to 24 hours. This intermediate acting insulin covers about half the day for the patient. It's usually used with rapid or short acting insulin. Your long-acting insulin like Levemir and Lantus usually lasts 20 to 24 hours. This will cover the patient's insulin needs for the whole day. Remember, your long-acting insulins cannot mix with other insulins in the same vial. Patient, if they're getting both of these at the same time, they need 2 separate injections. Then you have all your pre-mixed insulin that comes in the pre-filled syringes. Usually these pre-mixed insulins are a combination of intermediate acting and short acting insulin. Teach your patients it's important to give themselves the insulin before meals. You want to teach them to roll the bottle in the palm of their hands, not to shake it. Inject amount of air that is equal to each dose into the bottle for your short acting, which is going to be the clear. Aspirate your short acting first, then your long or intermediate acting insulin, which is going to be your cloudy. It's recommended you use alcohol to clean the bottle. Remember, this is a subcutaneous injection, not an IM injection. Teach your patients where they can give themselves the sub-Q injection and to rotate the site about 1 inch apart with each injection. These pre-filled syringes need to be stored vertically. If the patient is sick, they may increase their insulin dose. Store your bottle at room temperature. Unused bottles need to be stored in the refrigerator. Teach your patients signs and symptoms of hypoglycemia. You want to teach them to carry some kind of sugar or candy on them, something with peanut butter, so if they do start having hypoglycemic signs and symptoms, they can correct it. You want to treat hypoglycemia with 3 to 4 glucose tablets, 4 to 6 ounces of a fruit juice or regular soda, or 2 to 3 teaspoons of honey. Glucagon 1 gram can be given sub-Q or IM. D50 can be given IV if needed. Your antibacterial agents, your cell wall inhibitors include all the penicillins, cephalosporins, vancomycin, protein synthesis inhibitors include aminoglycosides, gentamicin, macrolides, erythromycin, tetracyclines. DNA synthesis inhibitors include Cipro or Flagyl. Aminoglycosides can cause nephrotoxicity and ototoxicity. Your sulfas can cause Stevens-Johnson syndrome and photosensitivity. So teach your patients if they're taking any sulfas to stay out of the sun and use sunscreen. Tetracyclines can cause bone problems. Erythromycin can cause hepatitis. It's important to collect any culture before you start a patient on antibiotics. Teach your patients to take a full dose of the antibiotics prescribed, not to stop taking the medication after they think they feel better. Check your client's history for allergies, monitor for adverse effects. All antibiotics can cause nausea, vomiting, and diarrhea. Cholinergic blocking agents. Your prototype for this is atropine. It blocks the binding of acetylcholine in the receptors of the parasympathetic nerves. It is used perioperatively to dry secretions. It is also used to treat spasticity of GI or urinary tract. It's used to treat bradycardia, asthma, and Parkinsonism. It is also used as an antidote for someone poisoned with insecticide. Adverse effects include dry mouth, dilation of pupils, tachycardia, urinary retention, ileus, and a heat stroke. If you're giving patients atropine, you want to keep them cool as possible. Watch for signs and symptoms of heat stroke and dehydration. Encourage clients to increase their PO fluid intake and use of sugarless gum or candy for dry mouth. If taking for GI symptoms, you want to teach your patients to take it about 30 minutes before meals. For your androgenic agents, you have epinephrine, terbutaline, albuterol. These stimulate the alpha and the beta androgenic receptors directly or trigger the release of catecholmines indirectly, causing sympathetic effects. These are used for cardiopulmonary arrest, hypotension, COPD, asthma, nasal congestion, any allergic reaction, and anaphylactic shock. Epinephrine is going to be your first drug of choice if the patients have an anaphylactic shock. Adverse effects includes restlessness, insomnia, tremors, nausea, palpitations, chest pain, tachycardia, and hypertension. It is contraindicated in clients with hyperparathyroidism, cardiovascular disease. You want to monitor your patient's vital signs. Drugs for gout. Your maintenance medication is going to be the allopurinol. These are different drugs and their antidotes. So for digoxin, antidote is Digivine. For heparin or Lovenox is the prometine sulfate. Morphine or any narcotic is going to be Narcan. Warfarin, vitamin K,